Hey friend, welcome to Grounded, the vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive headfirst into a journey to discover the mysteries of the brain, the inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing dizziness for one day or 25 years, we're going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. Hello and welcome back to Grounded. My name is Madison, and today we're talking about the differences between Meniere's disease and vestibular migraine, which is a question I get all the time, but they are not the same even a little bit. So before we get into that, I want to read this week's win of the week, which is by Alyssa. Alyssa says, after 2+ years since my last wakeboarding session, I was finally able to, even after being in 111-degree heat. I used my toolkit, kept hydrated, took breaks when I needed to, and had the most amazing time ever. I cannot describe how perfect it felt. So incredibly grateful. And then she sent or attached a video of her literally wakeboarding, which is phenomenal. So super, super stoked for Alyssa. And I love that she's like, yeah, I used my tools. I did the things I needed to do. And then I went wakeboarding for the first time in 2 years. I also know that she did this after driving all the way to Arizona to do so. And also like having been on the boat for a while, which all of you know that none of those things are easy feats by any means. So congratulations to Alyssa. Anything that you want to do is always going to be possible with a vestibular disorder. And I know that she posted on Instagram this video and tagged me in it too and was like, literally anything with a vestibular disorder is possible. It is true. Anything that you want to do with a vestibular disorder is always possible, given the right tools, the right things that you need, and going slowly, building your way up, all the things. So congratulations to Alyssa. I can't wait to see you do what you do next. You're always doing something hilarious, amazing, adventurous, so fun. She recently went to Red Rocks. She had to fly to Colorado, drive, went to a concert, like the whole 9 yards. So anyway, anything that you want to do is always possible. So congratulations again to Alyssa. Let's get into the episode. Today, we're talking about the differences between Meniere's disease and vestibular migraine. The first thing that you need to know is that Meniere's disease is a peripheral vestibular disorder, meaning it's happening in the inner ear itself. And vestibular migraine is a central vestibular disorder, meaning it's not affecting your inner ear at all, technically. It is affecting your brain and the way that your brain is receiving or processing information from the rest of your body. Now, here's the thing with vestibular disorders, which you guys probably know already, is that literally every single vestibular disorder has the exact same set of symptoms. The differences are super tiny, little different things that just kind of depend on the person and can be differentiated by specific things. So the Meniere's disease diagnostic criteria are very specific. And although both VM and Meniere's can both cause room spinning vertigo, for example, the way that it looks in practice is really, really different. So, Meniere's disease diagnostic criteria, we are going to read from. There are criteria for both definitive Meniere's disease as well as probable Meniere's disease. But here are the definitive Meniere's disease diagnostic criteria. 2 or more spontaneous episodes of vertigo, each lasting 20 minutes to 12 hours, audiometrically documented low to medium frequency sensory neural hearing loss in one ear, defining the affected ear on at least one occasion before, during, or after one of the episodes of vertigo. Fluctuating aural symptoms, which is AURAL, not oral, it's aural symptoms, which are hearing, tinnitus, and fullness in the affected ear, and not better accounted for by another vestibular diagnosis. Now, a lot of these symptoms, right, are really similar to other vestibular disorders. You can have hearing loss from other vestibular disorders. You can have tinnitus from other vestibular disorders. You can have fullness from other disorders. You can have room spinning for other disorders. But the thing to know about Meniere's disease is how honestly uncommon it is comparatively to something like vestibular migraine. For instance, Meniere's disease, the prevalence of Meniere's disease in the general population is about 0.2% of the population. However, the prevalence of vestibular migraine in the population, which they also assume half of the people are undiagnosed, so it's even higher than this probably, is 2.7 to 3%. Really common. In order to be a rare disease, you have to be less than 2% of the population. Vestibular migraine, not rare at all, actually relatively common. Meniere's disease, pretty rare, not super common, really overdiagnosed. And this is because the diagnostic criteria for Meniere's disease came out way before the diagnostic criteria for vestibular migraine. And so then people have heard and doctors have heard of Meniere's disease and not VM. And then they're like, oh, you had spitting, how funky. And you have these like internal symptoms. Okay, must be Meniere's. When in reality, it's really often migraine. So that vertigo, that lasts 20 minutes to several hours, is coming from nystagmus. Now, remember, nystagmus is involuntary eye motion. And in this case, the nystagmus is caused by one ear being stronger in its signaling than the other. So when you're having a Meniere's attack, basically one ear is not functioning as well as it could/should, and the other ear is functioning normally. Therefore, you get this spinning effect in the direction of the normally functioning ear. So if you have, let's say, left-sided Meniere's disease, your nystagmus is going to go to the right, which I should say the fast phase of the nystagmus is going to go to the right, which seems counterintuitive, but that is the way it is. This will last at least 20 minutes, but up to 12 hours. And they say that if your spinning is lasting more than 12 hours, not you feel like you're spinning, that is not what we're saying. I'm saying you are laying in bed or you are sitting here and the room is spinning around you. It is a very different sensation than I feel like I am spinning. These two things are very different, not the same. And when you're like, I'm spinning, I'm spinning, I'm spinning, but you're like, I don't see the room spinning, but I am spinning, that is not what I'm talking about. I'm talking about you see the room spinning around you. Now, you can try to suppress it by staring at something on the wall. I recommend people with Meniere's disease put a glow in the dark sticker on their ceiling so they have something to fixate on if/when they are having an attack. Some people like to also put something to just stare at like under their table so they can get under their table quickly, because a lot of the time Meniere's disease comes on randomly. Meniere's disease is the inner ear's failure to regulate pressure. Now, this is theorized by coming from many different places. It is theorized it could be from dietary issues, autoimmune, a form of migraine, genetic, allergies, variation in the size or position of the endolymphatic sac, vascular irregularities, blocked drainage pathways, viral inflammation, and other places. So they don't know or we don't know what is causing Meniere's disease, basically. So that being said, I also want to state while we're talking about Meniere's disease that 40 to 60% of people, so let's call it 50% of people who have Meniere's disease also have vestibular migraine. And that 45% of Meniere's disease patients experience migraine symptoms during an attack. So this makes even more confusing. So what do we actually do about it? Typically, you give it your best shot in starting with the conservative options and working towards surgical options. So dietary and lifestyle changes often have a really, really big effect on Meniere's disease, and can be super helpful. Then we go to medications, then to injections, and then to surgical options. Dietary and lifestyle changes, and unfortunately, most of these things say that they are likely to have more benefit than harm to the patient, but there's not like great randomized control trials, even on limiting salt, that show that it definitely works. So limiting caffeine, salt, increasing hydration, exercising daily, sleep hygiene, managing allergies, smoking cessation, not drinking alcohol, and avoid meds that increase water retention like NSAIDs. You can try diuretics, antihistamines, then there's steroid injections, there's gentamicin injections, and then there's, of course, a labyrinthectomy or endolymphatic sac surgery, vestibular neurectomy, and sometimes ear tubes. So those are the treatments typically for vestibular migraine, but the consensus of these things that honestly, they're not great. Like, they're just simply not that, um, they're simply not that effective. And if you have Meniere's disease, you probably know that. You're like, yeah, it's like kind of helping, but not really. That being said, there is some newer research about radical scavengers for Meniere's disease, and this is kind of going off topic, but if you have Meniere's, you should know that it is says that different antioxidants that you take in your body could ultimately be helpful for controlling poorly controlled Meniere's disease. So vitamin C, glutathione, things like that can actually be legitimately difference making. Vitamin D, zinc, omega-3s, vitamin E, all of these different things for Meniere's disease. And you can do, I shouldn't say do your own research. That is not the correct terminology. I hate when people say that, but look into this with your doctor and look into the research is what I should say. Look into the research about these things because ultimately, inflammatory responses and radical scavengers, which that sounds like a lot worse than it is. They just mean like oxidative species, basically, not antioxidants, can affect Meniere's disease, and that antioxidants and supplements like that can be helpful. So specifically, the difference between Meniere's disease is that Meniere's disease is a peripheral vestibular disorder. It can be sometimes diagnosed via VNG if you've had it for a long time and now you have a hypofunction. It can be diagnosed via ECOG, or these different types of inner ear testing. Some things will tend to come back positive, whereas with vestibular migraine, typically nothing will come back positive on any of your testing. And vestibular migraine, on the other hand, is a neurological condition that comes with tons of different symptoms, whereas the main hallmark symptoms of Meniere's disease are ear symptoms plus this really long-term spinning. Anything shorter than 20 minutes, anything that changes direction randomly, or anything longer than 12 hours, we typically say is actually related to migraine. Again, I am not a medical doctor. I do not diagnose these things, but this is what both the clinical and diagnostic criteria tell us, as well as what I have seen from medical doctors and ENTs and things like that. Vestibular migraine typically should not cause hearing loss, where Meniere's disease will. And Meniere's disease, the hearing loss over time will be sustained, and it will be in a low threshold. So the hearing that we lose with age is typically high pitched noises like squeaky stuff and mosquito sounds. Like we all had the mosquito ringtone in elementary school or whatever when we got phone, or middle school, I guess. High school when we got phones, so like the old people couldn't hear it because typically with time, hearing loss that comes is related to high frequencies, like mosquito sounds. Um, and then, oh my goodness. Typically, migraine runs in families, not always, but often. And so, if you have a family history of migraine, it is more likely to be migraine. It could also be that you have both. Some people are like, I have this 6 to 10 hours of room spinning vertigo, let's say, and I feel like I get like this roaring tinnitus or I get this hearing loss or whatever, this ear fullness, but also I get like light sensitivity, sound sensitivity, sometimes headaches. You can have both. And that's where having a doctor who either understands both and is able to treat both, like some neurotologists, there's not a lot of doctors who can slash will treat both, or who are able to say like I'm going to treat the migraine part and then they're going to treat the Meniere's disease part can be really helpful. Vestibular migraine can last a couple seconds to a couple days. Room spinning, not required. Head pain, not required for either of these diagnoses. So don't get that twisted up because that can be really confusing. And then headaches with Meniere's disease will never happen, pretty much, like from the Meniere's disease itself. So if you think you're on the Meniere's disease track, audiograms over time to track your hearing loss is going to be important. Making sure your vertigo episodes do not have migraine features. Making sure that you have no other evidence of a different vestibular disorder. So things like that. And you can also get vestibular function testing like VNG or calorics, which again, over time, those will start to reduce, but it's not going to be immediate typically. Typically with Meniere's disease, like things start and then they go back to normal and you're like, that's so weird. And then like over time, it progressively gets worse. Whereas vestibular migraine, things don't necessarily progress and the results in your brain, in your vestibular system, in your body do not typically progressively get worse. Yes, untreated migraine becomes worsening migraine. Yes, but this is like Meniere's disease is a disorder that progressively, quote unquote, I shouldn't say lessens the effects. What is the word that I'm looking for? That progressively like makes your vestibular function worse over time. So your VNG will come back more positive, your audiogram, your hearing loss will get worse, things like that with Meniere's disease. Diet and lifestyle ultimately are going to help with both. Vestibular suppressants, super helpful in Meniere's disease attacks, not as helpful in treating vestibular migraine long term. VRT could be helpful. It's going to be more helpful for Meniere's disease. It's not here to prevent Meniere's disease attacks. It's here when your brain and body start to be like, hey, you know what? I'm having a harder time with these different things and processing these different things. That is when you're going to need to start getting VRT for balance, for gaze instability, stuff like that. VRT works for some people, doesn't work for other people when it comes to VM. And then supplements like magnesium, CoQ10, riboflavin, creatine. I guess I shouldn't put creatine in only one boat because that technically is an antioxidant. But they are proven for vestibular migraine, and different ones are more proven, but not as frequently used. So if you look up literally the research, or you can go in Vestibular Group Fit and look for the coaching call about radical scavengers for Meniere's disease. That's something that I recommend doing. Whether you have vestibular migraine, Meniere's disease, or both, the truth is that these things are very disruptive in your life. They are very frustrating. They are not straightforward to treat. Luckily, they are both treatable. They do both get better. And just having the right treatment plan, the right doctor, all of those sorts of things is going to make a big difference in your life. So, thank you so much for joining me to learn the difference between Meniere's disease and vestibular migraine. Remember, Meniere's disease is a peripheral vestibular disorder. Vestibular migraine is a central vestibular disorder. If you want to learn more about um, central and peripheral vestibular disorders, we have central disorders and peripheral disorders podcast from the very beginning of this podcast. Central vestibular disorders is uh, episode 4, and peripheral is episode 8. So definitely look into those. If you have any questions about this, please let me know. You can comment below. You can slide into my DMs at the Vertigo Doctor, and we will clarify anything. All right. Love ya. See you next week. Same time, same place. Bye.